question answer session. I basically today chose winter coughs because of late winter has come and there are a lot of cases of cough, cold, coryza, and sometimes these type of cases becomes very difficult to treat. So you must have some of the inputs where you have to understand that whenever winter sets in or whenever there is winter. Okay, I'll first wait for a few seconds to let people join in because there is a message from people that wait for a minute. Okay. Yeah. So winter cough basically is a topic for today. Of course, in between, if you have any questions, you can keep asking. But I was telling about winter cough. It is so important to understand whenever there is winter cough or whenever there is cough because of winter or in winters, there are few remedies which are very, very important and which should be thought of in lot of complaints of winters. For example, whenever winter cough starts, we normally think about few remedies which are very, very common and of course they give very good results. The first remedy that you should think about in winter coughs is, or we have cough, cold, coryza, sneezing, water discharge, anything. So welcome Dr. Purva, Dr. Imran, Dr. Patel, Dr. Sasodhya, Dr. Anja Smith. So whenever there are winter coughs or you can have aggravation cold, first remedy that everybody should think about is arsenic album. Of course, see, a lot of people have known that arsenic album is a chili remedy and there are all the symptoms are covered in arsenic album. For example, if you see coryza and if you sneezing, then also the first remedy should be arsenic album. But of late, you must think about few remedies which are very, very important. The first remedy that you think about after arsenic is phosphorus. Phosphorus, because it is a polycrest remedy, we feel that okay, let the acute phase go and then we'll think something about phosphorus. Is not like that. If the symptom corresponds, you have to get the remedy phosphorus, and phosphorus covers a wide variety of winter complaints. If you go home and read some mathematics about phosphorus, it basically has most of the symptoms of winter coughs, most of the symptoms of cough, cold, coryza. That is phosphorus. For example, if you open your mathematics, any mathematics, and see phosphorus chili patient, and the cough of phosphorus is also so important. Whenever the phosphorus patient starts coughing, uh, it is said that it has classical taste, bloody taste in the mouth. Now it is not always possible that phosphorus you start prescribing at that part when the taste of the cough becomes that bloody taste. There are other symptoms of phosphorus also that you should remember. I think when I was taking something about corona, I told something of phosphorus. In phosphorus, the larynx are very painful. Yeah, welcome, Dr. Birwala, Dr. Ashwin. In phosphorus, the larynx is very painful, and this is important, because uh, I can't see question answers on YouTube. Just a minute. So, yeah, good afternoon, Dr. Purva. I can't see question answers on YouTube, so I'll just see what's happening. Yeah, welcome, Dr. Ganesh. So, welcome, Sultan. So, larynx is painful, and in phosphorus, remember, I have seen clinically there is hoarseness worse in the evening, or there is aphonia, which is worse in the evening with rawness. These three, four symptoms of phosphorus are very, very important in winter coughs, and the cough is hard, dry, and racking cough. These three symptoms, if you get in a patient, do think about phosphorus. Don't wait to give an acute remedy first and then think about phosphorus because it is chronic. As I always tell you, whenever acute symptoms come to your patients come to your clinic, it is very important to realize because sometimes what happens, these acute complaints come because you have not hit the simillimum. So the larynx is painful so much, the patient cannot talk because of the pain. So don't always think about causticum, don't always think about causticum. Phosphorus is also there. Phosphorus is also there, and this is why, sorry, in homeopathy, it is important to understand a remedy symptom. Hoarseness in the evening, aphonia in the evening, hard, dry, racking cough, and cannot talk because of the pain in larynx. That is phosphorus. As you go further, of course, HEPA sulfate is there, a lot of other remedies are there, but one remedy that you should think about is Kali carb also. Again, because Kali carb is a constitutional remedy, it's a deep acting remedy. That's why we say that, oh, Kali carb will first give an acute remedy and then go for Kali remedy or the constitutional remedy. It is not like that. Kali Karab also has a very, very interesting symptom, very, very important symptom in regarding to cough. If you have Kali Karab, you have to remember one thing in cough symptom, and that is a Kali Karab cough basically has the whole chest of Kali Karab patient is very, very sensitive. Remember that the Kali Karab chest is very, very sensitive, and because of this sensitiveness, there is a lot of pain, there is a lot of cutting pain in the chest, and the patient is worst when lying on the right side. Remember the side in Kalikarp. The patient is worst when lying on the right side, and leaning forward in Kalikarp relieves the chest symptoms. So these 3-4 symptoms of Kalikarp are very important. I am telling you the polycrest remedy in winter cough because I've seen whoever students who have joined me, they first think about remedies which are very acute, Sabadilla, Rumex, Sabadilla, and ask him why. Yes, sir, we'll treat first the acute and then think of the chronic remedies. No, it's not like that. If the symptom correspond, phosphorus is there, Kalikarp is there, hipersulf is there, soranum is there, arsenic is there. These remedy work when the symptom correspond. I'll just take one question before I go. Buccal mucosa and gum feels sore after taking cold foods and alpha Q and some lesion on side, but has frequent aphthous after hot and chilly food. See, if the patient has frequent aphthous and you are specifically writing that it is after chilly food. So in most of the cases I have seen that aphthous basically after chilly food quite taken as normal. But if you still want an answer, then you have to define your aphthous. They are blackish in color, they are reddish in color, it is bleeding easily. See, there are a lot of symptoms like burning or a bluish in color. So there are a lot of other symptoms of aphthous. In general symptoms of aphthous, you can think about remedies like arsenic album, Merxol, Nux vomica, borax. One or two remedies which are very, very uncommon, but I have got good results. The first is kali chlor and the second is sulfuric acid. Now, you remember that in borax, the aphthous are easily bleeding aphthous. Patient बोलेंगे डॉक्टर साहब मैं जब भी हाथ लगाता हूँ ना खून निकलना शुरू हो जाता है. That is borax. Bluish in color is arsenic album. Blackish in color, it is baptisia. So make an effort to go ahead and then define that symptom so that you can understand that. Yeah, good afternoon, Dr. Meera, Dr. Bilwalkar, Dr. Patra, good afternoon. Hi. Reddish in color and emulsion. Yeah, so it is reddish in color. So whenever the aphthous is basically a reddish in color, there are few remedies which I told you, like we have arsenic, we have mercury, we have Nux vomica, we have borax, we have muriatic acid, we have sulfuric acid, we have phosphorus, we have creosote, we have lycopodium, we have magcarb. So this is a very, very important symptom. But again, then you have to differentiate aphthous of where, sides, left, right, middle, and reddish in color, fiery red or dull red, dusky red. Then it again goes on to the defining of the symptom. But as I always say, basically, just by taking one symptom of by eating chili food, you have aphthous. Don't take that for prescription because it might fail also. One symptom, yeah, Dr. Krishna, welcome. Adenoids with continued cold with green discharge and cough aggravated night. Please suggest remedies. Yeah, see, adenoids. I always say adenoids basically is a very, very common symptom, especially in children. They will come to you. The patient comes to you. The parents come to you and say, "Sir, whenever my son or daughter sleeps, there is a lot of what you call sound from the nose. There's a lot of snoring, and basically because of that, we can't sleep. He also gets up and then starts snoring. It is that." I'll get back to doctor. I'll just finish that. So there are few remedies which are very, very important. What symptoms we have told, greenish discharge, adenoids. Think about Merxol, think about Medoranum, think about Conium, think about Calcarea floor, and of course think about Nux vomica. These are very, very commonly indicated remedy which I have got good results with. Dr. Tanzil Rafaq, welcome. Alpha Q for frequent lesions on sides of the tongue. Basically what happens, alpha Q I have not used in case of aphthous because yeah, sometimes people say that aphthous because of deficiency of vitamin B12. So make sure that the patient is advised a proper diet, so that takes care of the alpha Q. There's no need for if you ask me. And if the proper diet is taken, check his B12. If it is low, then give him B12 rich foods, and that should take care of it. And if the immunity is low, you feel, then you have to take the whole history and then prescribe so that the whole constitution becomes better with your similimum. Is there any side effects of alpha? No, I have never seen side effects of alfalfa in my practice, because it's a basic tonic, and alfalfa contains lot of flavonoids, lot of tannins, lot of minerals and vitamin K also. So it has no side effects. You can use that. 60th-year-old man suffering from occlusion in right ICA and infarction in thalamus. Patient is in ICU. What should I give? I think this was the photograph Dr. Mirayo sent me, no? So I had to actually sit down and today take the case. I hope we are not late. Recent histogram, patient completed the trek of 13,000 steps, and that he had fever and started come. Okay, so we can say that maybe this is suffering from. Okay, I'll just give the answer to that. Occlusion of the right carotid artery with infection. So in this case, whenever there is infection because of lot of if our history taking is right, infection because of a lot of exertion he has done, you have to think about 2 or 3 remedies, and I would say start the case with arnica. Arnica gave him by inhalation on the upper lip, so that it goes directly to the by olfaction, and give it repeatedly 1 hourly till you get the first change after the remedy, and then you can decide on other remedies. I discussed a case of septic arthritis where the patient had gone to climb the mountain. It is the Pune patient, and he developed septic arthritis with the same history. Which remedy will we give? Anybody? I think everybody should remember that remedy, because we treated that case with 2 doses of the remedy, which was on the WhatsApp. So that was the same history. He went to climb the fort, and because of lot of exertion, there was level exertion, and he developed the arthritis, and doctor told him to operate, but 2 doses of our indicated medicine cured the case. Of course, I asked him other symptoms also, like the first symptom which I told you in that case was anguish when alone, and we clubbed that symptom and the remedy was cured. So in this case, we only have this type of history, that 13,000 steps, because of exertion the immunity was low, so the body came out with fever, and that's why arnica should be indicated. I hope it and give it repeatedly, so that we get results, and after you get results, start tapering of the medicines. Yeah, so in case of adenoids, if you go home and read adenoids, it is such an important symptom, because you will get of late a lot of symptoms of adenoids in children, and if you are able to cure that, it's a very interesting thing, because see, the patient starts snoring, and when the patient starts snoring, the parents are a bit worried that what is happening. They have this disease, that disease. So it's very important in adenoids to basically first look at the symptoms, and look at the site, and look at the basically thermals also in the child. For example, we have remedies like calcarea carb also, lycopodium also, sambucus niger also, sanguinary nitricum also, which I told you before also. Yes, Dr. Hetal has guessed the remedy right. We had given the patient phosphorus 202 doses in the case of septic arthritis, and that was cured. And fantastic. I am very happy that at least you all are remembering what I have taught you. That is more important. Otherwise, what will happen? I keep on speaking and nothing comes from your side. So very nice, Dr. Hetal. Keep it up. Dry cough with stitching pain in the throat, chest pain with coughing, Brownia did not help. Yeah, so see what happens when the cough is dry, and it is a classical symptom, that stitching pain in the chest. So automatically, what happens, that we try to understand, we try to give one remedy, that is Brownia alba. Now see, in Brownia alba, there are other symptoms also. The patient hold, because see, in Brownia alba, the stitching pain in the chest, and the patient holds the chest, because the pleura is very painful, and every time it is not Brownia. So there are some remedies which should be thought of in this type of complaints, because if you see stitching type of pain with Brownia, three remedy, of course there are a lot of remedies, but 3-4 remedies which I found very useful with Brownia is: first is Brownia, second is phosphorus, third is Calicarp, and the fourth remedy that you should remember is Rumex crispus. Okay. Sorry for the, yeah. Good afternoon, Dr. Kocher, Dr. Nujot, and we had an interesting case of hyperlipidemia with, I think Dr. Nojot would share. We had a case of hyperlipidemia where the cholesterol, I think, was 254, and the triglycerides about 770. We prescribed a dose of medicine, 2 doses, and after 5 days, the cholesterol was 204, and the triglycerides came down, I think, to 190 or 97. A very interesting case from Dr. Nojut Baba, and she had given the remedy after consulting me, and just 2 doses of the medicine cured the hyperlipidemia in 5 days. Whenever I used to teach cases of hyperlipidemia in my practice to the students in the seminars, the students would feel, oh my God, how is it possible that it is cured in 5 days? But now people ask me on WhatsApp also some remedies, so I share the remedies, and we have Dr. Bawa who could throw some light on that case where it was cured in 5 days, hyperlipidemia. Even the patient, I think, would be surprised after seeing the reports of his cholesterol and his triglycerides. The remedy, I think Dr. Bawa would share the remedy, and it was a fantastic remedy and fantastic case. So I hope stitching pain in the chest, everybody has remember. Now ask, when is the stitching pain in the chest? If the patient comes and tells you that the stitching pain in the chest is during cough, remember this symptom, the stitching pain in the chest. If it is during cough, do think about 3 remedies, very, very important. The first is Bryonia, second is Drosera, and third is Merxol. I just got one thought. I had a case when the patient complained about stitching pain in the chest during coryza. During coryza. And then you get very confused now what to do. The patient बोलता है जब मुझे सर्दी होती है ना, मुझे छाती में काफी दर्द करता है. So which is that remedy? Anybody? Which is that remedy? Stitching pain in the chest during coryza. Remedy? Yeah, Dr. Razik, we have a WhatsApp group, but this basically was a question asked by Dr. Bawa on her WhatsApp, and she had a case of hyperlipidemia, and I discussed that case with I discussed the case, and we had good results with that remedy. If Dr. Bawa is listening, I think she can share the experience. But I was telling you, if the patient complains of stitching pain in the chest during coryza, then Bryonia is not indicated. Which is the remedy that you should think about when the patient says there is stitching pain in the chest during coryza? You'll have a lot of cases today, arsenic and causticum. No, Dr. Meera, very close. Stitching pain, सर्दी के टाइम पे छाती में दुखने का जरूरत ही नहीं, but there are remedies where the patient complains of stitching pain in the chest during coryza. Remember, these symptoms in homeopathy are so important, it could define the whole case, you know. So this is very important to understand and to differentiate the material. Material medical knowledge sometimes to differentiate becomes very, very important. Write down in your mathematical books, when there is stitching pain in the chest during coryza, there are 2 remedies which are very, very important. The first is Merxol and the second is Borax. Yes, so Dr. Bawa has shared that case. It was an amazing cure with lycopodium 202 doses. So that's why I always say that the transparency of results have to be very important. You know, you should always share your result where you're very transparent, and whatever you're saying to the audience should believe in you. See, 5 days curing hyperlipidemia, if I tell you and I have no background, that it might become sometimes difficult to digest. But we have Dr. Bawa who has written in here that it was a fantastic case, an amazing case, cured with lycopodium 202 doses, and that was a fantastic recovery. Of course, you will be surprised when you see those results, but when you start getting the results, you feel it's okay. It is just one of the other cases. That's how homeopathy has to be learned, has to be studied, and has to be adapted. You know, that's very important. Please stick to the basics, stick to the basic books, and I feel what results I am getting, you will also get it. Be very basic in your prescription. So thank you, Baba, for sharing your case that we cured that case, you know. Yeah, Dr. Bhavankar, if you have a case of asymptomatic thyroid nodule, see, maximum times, you know, Dr. Indranil, you have thyroid nodule which are asymptomatic. Whatever procedure I follow is that I basically take the whole case and then prescribe the remedy. I don't prescribe calcarea floor or ruta or phytolica or these type of remedies which are only related to that growth. So It is basically the whole constitutional remedy I prescribe. And of course, if you get symptoms of nodule which causes pressing pain in the throat, difficulty in deglutition, in speaking, and all the remedies definitely we have. Acid phos is not there, Dr. Redens go on. It was borax and merxol. Is there any stitching pain in chest in keloid? Yeah, yeah. You see, keloid altogether is basically a different disease, and in keloid there are a lot of different type of pains because once the keloid starts getting infected, then the pain may vary. It can be stitching pain, it can be boring pain, it can be pulsating pain, depending on the type of keloid and where the keloid is situated. Good afternoon, Dr. Sachdeva. Sir, I have 201 m potency of Arnica. Should I give LM? Potency is not available. If LM is not there, start with 1M, Dr. Meera. So, Dr. Baba, could you put the values of the total cholesterol and the triglycerides which reduced after 5 days of that, because people will get more confidence and people will get more benefit from that answer, because if you share it, it would be better because you have given the dose and you have seen the results. If you could share the values of the cholesterol and triglycerides which came down within 5 days. Now, one more thought that has come in my mind in that stitching pain, because now coryza we have seen cough also. And when the patient says, now see what I'm telling, when the patient says that there is stitching pain in the chest on inspiration. So whenever there is stitching pain in the chest on inspiration, then also the remedy are different. Of course, bryonia is definitely there. Then you must think about three remedies which are very, very important. First is bryonia, second is kali carb, and third one is natramure. Yeah, within 5 days, Dr. Baba, we know basically we need the values of the cholesterol, how much it came down in 5 days, and triglycerides, how much did it come down. So it would give a very good impact. Okay. So the remedies where there is stitching pain in the chest on inspiration, think about bryonia, think about kali carb, and think about natramure. These are very, very, of course, there are other remedies also, but these 3, 4 remedies, like one aconitis there, have given me lots and lots of results with these type of symptoms. Patient had cerebral hematomas after accident, now complains of delirium with forgetfulness. Okay. So understand the delirium. Whenever you open a remedy and then you have delirium. So whenever you open a remedy and there is delirium, see, there are so many remedies for delirium. The delirium, for example, if you open any mater medica, or if you open repertory, you see there is delirium means, Dr. Mende, like for example, delirium antics plays, delirium crying, delirium erotic, delirium answers slowly, and then again relapses. So there are a lot of symptoms of delirium also. For example, I'm talking about phosphorus. In phosphorus, in the delirium, the patient plays antics like phosphorus, like hyoscyamus, like opium, like plumbum, like stramonium, delirium. Or for example, in delirium, the patient answers slowly and then it again relapses. So we have phosphoric acid, we do have phosphorus, we have helleborus. So in delirium also, which type of delirium, and during delirium, what is the patient doing? That is also very important to understand, Dr. Mende. So it is always important to define your symptoms so that it is very easy for the physician to arrive at a simile. So I hope delirium is clear, Dr. Mende. You try to get the delirium part more precise so that it is easy to prescribe, in those cases. So as you go further, I'm telling you the basic remedies, not rare remedies, and otherwise people are confused at why rare remedies and all. So this is how basically I prescribe. So see, a simple stitching pain in the chest have so many permutation combinations. So whenever you're taking a case, make sure, headache better with pressure, like person of 50 years sitting on it. Yeah. This again, Dr. Sachdeva, no, a headache better by pressure is again, I would say, lot of most of the remedies, if you say headache is better by pressure, and you can say heart pressure, you can say that. But believe me, don't prescribe on that symptom, because there are so many remedies, where the patient says that my headache is better by external heart pressure. The patient says that as if somebody should sit on my head and I feel better. But as you have asked the question, I will just tell, I'm just telling the remedies. there are few remedies which are very, very important, Dr. Sachdeva. And of course, it would definitely give that temporary relief. And the remedies that you should remember: China, Macphos, Belladonna, Sanguinary canadensis. These four remedies have a classical symptom that the patient says that the headache is better by heart pressure. Heart pressure. So remedies are belladonna, China, Macphos, sanguinaria. And of course, if you see, those are congestive remedies. So this is a congestive headache. So again, in congestive headache, it is basically better by heart pressure also. So this is very, very important that you understand. In fact, if you say of course, there are symptoms also where the patient says it is aggravated by slightest touch and aggravated and better by heart pressure. That also covers by China, Naxomica, and lacasis. So remember those symptoms. I hope you got the. Sir, how to manage asymptomatic hypertension, especially C? Yeah, yeah. No, if you have a case of CKD, doctor, generally there are two main causes for CKD. It's either hypertension or diabetes mellitus. So if the patient is suffering from hypertension, that's why he has got CKD. So you have to maintain. It can never be silent hypertension. If it is silent hypertension, patient is good, not getting symptom, the kidney will be damaged more. So it is very important to check the blood pressure of the patient every day. I do that in my patient because until the hypertension, whether it is symptomatic or asymptomatic, does not come in control, the CKD will not be cured. First thing. And second thing, if the hypertension is asymptomatic, we have patients who BP would be 200 and there's no symptom. That means the patient is such a closed personality. He does not come out. It's like a volcano burning inside. The patient is so, you can say it is so suppressed, reserved, introvert, just bearing the whole emotions by himself, does not coming out. That's why the pressure in his, whenever the pressure here increases, automatically the pressure increases in the body. So make sure that in case of CKD, you have to treat that hypertension or treat that underlying blood sugar symptom. Otherwise, CKD would never be cured, no, because that causes CKD. See, of course, you can always say that, sorry, you can always think about, see, elements from suppression. Then you see, everybody passes through a stage of suppression. What thought you have suppressed, and that suppressed thought has created that space in your mind, and that suppressed thought has still not gone for years and years and years, and that has caused inroads in the body, and that's why the patient lands up in hypertension and CKD. Simple element from suppression, a lot of people have it, they have acute symptom and it automatically goes off sometime because the constitution is strong. And then the series of suppressions, the years of suppression, the years of some thought which the patient could not do in life, that suppression is there, that has created that inroads in the patient. It has hurt the whole economy. And then you have these diseases like CKD or diabetes or cancers and all. So first, it is very important to evaluate those cases, rather than getting into one symptom of element from suppression, which most of us have it, and then prescribe on that. Because otherwise, what will happen if you take those symptoms of element from suppression, you basically land up in only those type of remedies. Like suppressive remedies, everybody knows that we have Tefesagria, we have Lycopodium, we have Nitramule, we have Ipecac, we have Ignitia, we have Aurum Metallicum. So only these remedies would come. But in CKD, go beyond that. As I always said, in CKD, look at the smell. The smell is changed, the smell, the taste. There are other things also. The finer sensorium symptoms also are very, very important. Medicines for your type of cough. My type of cough. No, I'm much better. I've taken the remedy also. I had cough since 3 days. It is much better now. It is 90% better. The cough is better and the sneezing as the courage has started. So I'm absolutely on the way to cure. Maybe in a day or two I should be cured. So I've already taken the remedy. Okay, so don't take that as cough of single paroxysm and give calcarea cough. I'm much better. I had 3 days before cough. So it's now the discharge is coming out. It's getting better. But that was a very agile question and answer. So it's already 3:30. So we do have some questions, but I have scrolled up again because there were some questions which I took at length to answer. And yeah. cough because of post nasal discharge. No, see, whenever you have cough because of post nasal discharge, now see, whenever you are basically in front of public or doing this, you cannot always start spitting in front of everybody, so we take in that and the cough then starts, because the thing which body has to throw out, you're taking it inside. So it's basically, don't take that for as a symptom. But cough because of post nasal drip, you can take that. Cough because of post nasal drip, post nasal, and because of that you can get cough. So see, there are remedies like you can think about remedies like Drosser, you can think about hydrastis, you can think about remedy like Spigelia. There are some medicines. Of course, I took some other remedies. I had classical cough and I took pulsatile, and it is much better now. So okay, so post nasal cough, we have post nasal cough, post nasal discharge. The patient takes inside the nasal drip, it irritates here, and the cough comes out. So it's a different thing. So as you go further, yes, Dr. Sasdeva, I hope you got the answer. Sir, approach of hypertension is not yet clear for me. Kindly take it next. Okay, fine. Okay, I'll take it. And basically, what happens? In case of CAD, in case of CKD, it's for me also. If you ask me also, very difficult disease to cure, but I'm getting good results. The patient is not getting cured totally, but we're able to maintain that creatine. We're able to reduce that creatine, and we're able to stop dialysis also. That's very important. So if you ask me, Dr. Sasdeva, post nasal drip because of that cough, three remedies that you should remember are very very important. First is Calibicrome, second is Spigelia, third is Lemna minor, and fourth remedy, write down in your books, very very important, of you will get good results, and that is Phytolica. Okay, so I think it's already 3:30, half an hour. Yes, I hope everybody got some clues to the questions. I tried to answer most of the questions. And welcome, Dr. Vishal. You are late today on Instagram. Thank you, everybody. Thank you for joining, and meet you next Saturday for our next YouTube live. Thank you so much.